All right, good afternoon, everybody. I'm here with Paul Mounds and Josh Jabal, and a couple of guests I'll introduce to you in a few minutes. Quick daily summary on COVID-19. These numbers are bouncing around a little bit, and I just ought to tell you, when you see 1,853 positive cases, you go, my God, that's an awful lot, or 204 fatalities. That's an awful lot. What's going on? In this case, the CDC changed their definition in the last few days of both a positive case and somebody who dies of complications related to COVID, or if somebody had COVID-like symptoms and passed away. So we're just truing this up so we keep with the CDC and federal definitions so you know where we are on a nationwide basis. You know me, the other interesting number in terms of direction is hospitalization. Over the weekend we went down, and that hasn't happened 2 days in a row since the start of the crisis. This time we went up a little bit, but you'll see as we go forward, the trend line is still down. Hartford, the top line is Fairfield. You can see there we definitely have bent the curve on the way down, hit the apex. I think we feel fairly confident about that. We're maybe 10 days behind New York City, a week behind New York City. Next line there is New Haven. They're maybe 10 days or so behind Fairfield County. That line is flattening out. You see we have good capacity in those hospitals, and they're able to help out Hartford a little bit. The blue line at the bottom, Hartford is still picking up, and that created small increase overall in our hospitalizations. This chart again, hospitalizations is the lead metric we can tell for how we're doing, but I'm going to give you some new metrics in a few minutes. But the 3-day moving average is down. That is good news. That says that we have good capacity in our hospitals, and to the degree to which hospitalization tells us something about the overall infection rate, that's a good trend line. But we're not out of the woods. And I just wanted to put this chart on here to remind you that these countries were all 2 weeks, 4 weeks, 8 weeks in front of the United States in terms of getting hit with this pandemic. We could learn a lot from their responses, and we can also learn a lot from what they didn't do right. Each and every one of them thought that they had this crisis under control. They loosened up on their social distancing, and each and every one of them now has seen an increase in COVID-related infections yet again. So we're going to monitor this very carefully. What I really would like to do, if I could, is give you an idea of what more we can do as we prepare for our May 20th date. You know, every week now, every Thursday, you're going to hear from our Reopen Connecticut team. And what happens between now and May 20th that gives us more information that allows us to make the right decisions so we can slowly, on a phased basis, reopen our state and do that very safely. And hospitalizations is one way to tell how we're doing, but it's sort of a blunt instrument. And I'll tell you a few other things we're doing, including testing or over and above testing, to give us a better idea of how the state is doing, how we're bending the curve, and where we can start up. And first of all, I'd just like to tell you about howwefeel.org. How We Feel is created by an amazing MIT neuroscience engineer and a number of people in epidemiology and infectious diseases. And we're going to you'll be able to meet him in just a few minutes. But right now with How We Feel, it's spread virally around the country in a computer science way, not an epidemic way. And what they've done is they're able to test different symptoms. You self-report on a voluntary basis symptoms, everything from cough, fever, and the such. You get that posted. We have thousands of people here in the state of Connecticut using the howwefeel.org app right now. And I'd like to say that we are the first state to officially sanction How We Feel as an official partnership. How We Feel is going to take information from all over the state. If more and more of you sign up for this app, it takes just a few minutes to put in your basic symptoms. And in turn, the leaders there, epidemiological, at How We Feel, will report back to the Department of Public Health here in our state and give us the best information they have in terms of what they see from these early symptoms going forward. More on that in a minute. Next, after the How We Feel app, we're doing a lot with thermometers. We've just got our first 3,500 smart thermometers. They're Bluetooth enabled. You take the temperature of yourself and your family in the morning and in the evening. That in turn connects to your phone. That goes up to the cloud. So along with How We Feel, we're going to have a temperature map of what's going on in the state of Connecticut. We'll see where those symptoms maybe are moving a little bit. Maybe they're followed by fevers in a more official way. Tells us where the next potential hotspot should be or can be. I mean, right now we know that just through infections and hospitalizations, New York is down and Fairfield County is down, Hartford is up. We know that Boston is up right now, so we worry about what's coming in from the east at this point. And we look around the rest of the country that Louisiana is down, or more particularly New Orleans, but Chicago is up. But within our state, there are respective hotspots, and How We Feel and our thermometers will allow us to test that. In addition, Josh has ordered tens of thousands of fever meters, a fever thermometer. And those are going to be incredibly helpful for us just to make sure that when you go into a manufacturing site, a Pratt & Whitney or Electric Boat or Sikorsky or any of the smaller manufacturing, anybody with a temperature more than 100.4, not allowed in. Doing this what we can in order to better protect you. And over time, we may find that we can open up our stores and retail and big box retailers a lot faster and sooner and more safely if we have that fever meter just to test people on their way in and make sure you're not likely to be contagious. We had a good phone call today with Vice President Pence's task force. A lot of conversation about testing as well. You can imagine, you know, some frustration from the governors that there's not more of the testing ingredients out there that you need. You know, the White House is saying you got a lot of capacity there, but we've got the razors, but we don't have the razor blades, if you can follow my analogy. And there, we're working hard to make sure that we're able to do more of, in particular, the PCR testing that tells you whether you're infected or not. And one good thing is the federal government is getting out of the way, and they're loosening the regulations for us, allowing the states to do be a little more entrepreneurial when it comes up to getting the swabs and it comes up with getting the reagents. And they've now said you can come up with your own swab and you can use cotton, American cotton if you want to, just like you have on a Q-tip. And opposed to some of the other liquids they use to transport, you can now use saline solution. Test that with Yale New Haven. Test that with UConn. Make sure it meets your protocols, but they're giving us a little more flexibility to be able to take the lead there. A final thought on testing. Well, I'll tell you, I thought I finally was able to figure out healthcare when the Vice President was talking about, so this is going to be based upon IRR. And I said, as a business guy, great, an internal rate of return. No, IRR stands for the International Reagent Resources. They're the ones that's setting the standards by which a state like Connecticut with great healthcare labs and resources will be able to figure out how we can accelerate testing by coming up with our own reagents and transportation media. Abbott Labs, I was down there on Friday for the first day, and they are now doing hundreds, ramping up to 1,000 tests a day. This is going to be a big part of our testing future. I thanked, first of all, the head of CVS, because CVS is sponsoring this, saying, it's amazing what you're doing in New Haven. I'd like you to be able to provide a lot of this drive-through testing in other communities, starting in Hartford as soon as you can, since that's where the surge is. And I'll tell you, President Merlot gave you a real compliment. He said, we've set up a few of these around the country, and thanks to the Connecticut Guard, thanks to the Connecticut State Police, this went very smoothly. It was up within 72 hours. We're now doing the testing, and you're going to be a priority to expand. Of those tests, I was a little sad to see that while Caucasians tested positive about 8%, African Americans tested positive about 35%. And we're going to do a much better job as we can to make sure that we have testing available for all of our people, especially those in the most diverse communities in our cities, and get them prompt attention to medical care. Make sure that nobody is left behind there. Finally, with Vice President Pence, we also said, what are you going to do with all this testing? It's going to be followed by contact tracing, and make sure that once we find out somebody maybe is infected or liable to be infected, we can make sure we figure out who else they may be met with over a period of time. The CDC is sending thousands of contact tracers out right now. You know, to me, there may be some civil liberties issues there, and it seems very manually intensive for a state like Connecticut with 3.5 million people, not to mention New York. So we're also looking at other ways that we can do this, as well as people power. One, as you know, is that Apple and Google are coming out with their app. I think it's going to be within 3 to 4 weeks. So the president mentioned it a month or so ago. And this will say for anybody who opts in, anybody who wants to be notified that if they recently came into contact with somebody who was later found to be a COVID carrier, you'll be notified. And you'll know that you should at least self-quarantine going forward. Finally, in the Vice President's call, we talked a lot about the business side of what's going on here and how we can provide support for people going forward. As you know, the Paycheck Protection Program, that was tapped out last week, and there's a real urgency to get another $250 billion. That's the money you need to help our small businesses power through for the next couple of months. David Lamont gave us some relatively good news that while by no means did all of the companies that need it get it, we did have over 18,000 Connecticut small businesses get access to that money. That's about $4.2 billion in aggregate. So we did relatively well compared to some of our peer states out there. The supplemental, which is the next bill that will be coming out of the Senate, obviously the governors were pushing hard for $500 billion to help pay for state and local governments in terms of lost revenue. And I had an occasion to mention to the Vice President the two other things of importance to our state and all the other states. One is the unemployment compensation funds. Fortunately, we had put another $150 million into it over the last year and a half. So we were relatively well-funded, but by no means well-funded, by no means not enough to deal with this, the level of unemployment claims that is hitting us. And said if you make that a loan to the states, which is what you traditionally do to true up that'll be a loan that's paid back by small business over the next years. And that's no way to dig out from under a recession. Make that a grant. And secondly, we're talking about a long-term loan to our state pension funds in general, those that are now underfunded in part thanks to the downturn in the stock market. And those are two things that the Vice President is going to be looking at as potentially part of our next supplemental. But let me take you back to howwefeel.org, because this is an amazing app that's going to put Connecticut at the very forefront in anticipation of more testing, being able to tell how people are doing, how they're feeling, and that's an early indicator of where our hotspots are. And first, I'd like to ask Feng Zheng to speak. He's a professor of neuroscience at MIT. He's been a leader here. We're so proud to be able to call you a partner and take the lead in making sure that how we feel is spread to, maybe hundreds of thousands of Connecticut residents taking the lead. Professor?
Hi, Governor, thank you very much for having me be a part of your press briefing. I'm from a project called How We Feel, and my day job is a professor at MIT. But since the beginning of the pandemic, my colleagues and I became very concerned about the virus and how quickly it is spreading through the community. We also recognized that there was a lack in testing capabilities. So we thought, can we come up with a different way to be able to track the spread of viruses? By talking with a number of colleagues and a number of concerned colleagues who want to volunteer to put together a new solution, we formed a nonprofit organization called the How We Feel Project. And through this project, we developed a mobile application called How We Feel, which is available through the Apple iOS store, the Android App Store, as well as via the web, so that people can download this app whether they're healthy or they are affected by COVID-like symptoms, they can provide information to help researchers and also policymakers better understand what is happening with the virus in their local community. Through this app and also through the web app, we ask individuals to contribute information, not their personal information, but only their zip code, as well as the symptoms and also a few other related information about how they are being affected by the ongoing pandemic. And through this information, we are generating models to be able to predict the emergence of new infection hotspots, to be able to get more granular detail in terms of where the virus has spread to or where it's going to become a emerging hotspot, so that more information and more guidance can be provided to those regions to be able to better combat the virus. As the society continues to cope with this virus, and as we begin to grapple with the question of how do we reopen the economy, we're continuously evolving our app to be able to ask questions and learn more about how the community is being affected by the pandemic, where are the most challenging problems that we need to solve, and then providing those information through the questions that we ask to policymakers and also researchers in public health and epidemiology, so that we can continue to best serve the general public to be able to overcome all of the devastations that this virus has brought us. And it's a great pleasure to be working with the state of Connecticut and the government of Connecticut. And we look forward to interacting on a regular basis, on a daily basis, with epidemiologists from the Department of Health to continuously monitor and also provide useful information to the people of the state of Connecticut. We have been collaborating with a large number of individuals, both experts in epidemiology from Harvard, from Yale, from UPenn, Cornell, University of Maryland, Stanford University, to be able to continuously analyze the data, glean, generate new insights about what is happening, and then provide the information back. And then we are also joined by other volunteers who are instrumental in developing the app, many software designers and app developers from Pinterest and also other companies, and also Ben Silverman, who is the founder of Pinterest, together both funding and also supporting this nonprofit initiative. One last point about our app is that as we read in the news that there is an enormous food shortage that has been brought on by this pandemic, every user that downloads the app is matched with a free meal donation of Feeding America. And this is a nonprofit organization that supports the food banks around the country. So we're hoping that we can provide up to 10 million free meals to people who are affected by this pandemic. We're really excited to continue to work with the state governments and also with the public health officials to provide useful information. And as you use the app, if you have any suggestions, please feel free to provide feedback through our website. And we're here to fight with you to help us overcome this enormous devastation. Thank you.
Thank you, Dr. Jung. You are amazing, and we're proud of this partnership. And as he mentioned, let me mention 3 more times, this is all anonymous. It's broken down by zip code, not by individual. And how we feel is being coordinated closely with our Department of Public Health under Commissioner Renee Coleman-Mitchell. But here in particular is Dr. Lynn Sosa. And Lynn has been working collaboratively with How We Feel. And how's this going to work for Connecticut, Lynn?
Hi, thanks, Governor. So we're really excited about this app. And the reason for that is because we know that the data that we get about testing is really just the tip of the iceberg. And so we want to have data about how many people are sick, as well as how many people are not sick at a given point in time. And that's why we're really excited about this app and the data that it can provide to us. It's going to give us another piece of information about how many people are sick at a given point in time and allow us to follow that through the course of this pandemic.
So both these resources are here to answer any questions that you may have. And with that, Max, any questions?
We'll start with the Hartford Courant.
Hey, Governor. I wanted to ask about the protest that's going to be starting in about a half an hour. Some of the rally organizers have said that they feel that the executive orders have overstepped a bit. Can you respond to that?
I can respond by saying you've seen evidence that our executive orders in the social distancing, thanks to the amazing people of the state of Connecticut, are working, that we are beginning to bend the curve, at least in the southern part of the state, and this is no time to take our eye off the ball. I loved it when Dr. Coe, who's co-leading our Reopen Connecticut effort, was asked that question. He said, I'd like each of those demonstrators to walk through one of my ICU units and see what pain and hurt and fatalities can result from this pandemic. So it's really important we do this on a safe basis, and how we feel is one of the ways we're going to be able to do it even more effectively.
There was also another press briefing this morning about the workers' compensation presumption. Do you have any plans of writing that into an executive order?
We're definitely going to take a look at that and see what that involves. Look, our essential workers are vital, and they are going in at some risk to themselves. And how we can work that into workmen's compensation is something I will figure out. But I can tell you, as you know, there's absolutely no cost for the testing for anybody, including them. There's no cost for treatment. You get at least your 14 days sick leave paid, and we're going to do better than that.
We'll move on to Channel 3 Eyewitness News. Channel 3 Eyewitness News.
Governor, yes, hi, sorry for the technical difficulty. I had a quick question about unemployment and claims that are labeled as processed. Does that mean the claim has been approved, still in the process? What does that exactly mean?
I believe process means they've been approved, and if the money has not yet been deposited, it's about to. Do you know more than that,
That's
Paul?
correct, sir.
That's about right.
Thank you.
Move on to the day.
Hi, Governor. Julia Bergman with the day. As your office and also the advisory committee debates reopening the state, is there thought given to reopening different portions of the state at different times? For example, might there be a different process for Eastern Connecticut versus Fairfield County, which is obviously closer to New York City?
Well, that's why I have this committee to help advise me on this, and I'm going to reserve judgment. As you know, my instinct is if I open Willie Brew in Willimantic, but there's no bars open in Stamford, you're going to have a lot of people traveling back and forth, and the virus could travel. That's probably not a good thing. That's why I've tended to work, on a regional basis, not just within the state of Connecticut, but perhaps some things can open on a local basis. So let's give our folks a couple of weeks. We'll hear back from them.
And one other question. You mentioned at the start that the CDC had changed the definition for positive cases and complications that resulted in death. Can you explain what those changes were?
Want to speak to that?
Yeah, actually, Lynn's the expert on this. Lynn, do you want to take that one?
Yeah, Lynn, thank you.
Sure. Hi. So the goal of a case definition is to make sure that when Connecticut says that we have a case of COVID-19, that we're speaking the same language as somebody in New York or someone in California. And so that's actually a joint effort between the state epidemiologists and CDC. And so that was something that came out actually probably about 10 days ago. And so we've made changes to make sure that we are reporting our data that is consistent and classifying cases according to that definition. And then we realized today that in our daily reporting that we had not pulled all of that information into our daily report. So as soon as we realized that, we made that update today. So this just affected data that we reported since Thursday.
We'll move on to News 8. News 8. Connecticut Mirror.
Professor, could you give us a sense of how broad a database would you need to have on this app for it to be useful? And do you have any idea as to how long it might take to build that database so, again, that you do have a useful database?
Yeah, thank you for the question. So we launched the app about 2 weeks ago, and as of today, we'll have about 300,000 users around the country. And in the state of Connecticut, there are about 3,500 plus users. And so we're hoping that we'll get more Connecticut users. From the data that we have been able to collect so far, we're already able to get useful information. So for instance, we find through our data that the loss of smell and loss of taste seem to be most strongly correlated with COVID-19 patients. We're also finding that testing is lagged behind, and also being able to receive testing result from when you first get tested, it can take up to 7 days for that result to arrive to the person. And so these are just some of the information that we're starting to find. In order to get more detailed location information, we need to have more users, and we're working on that. And hopefully in the next week or so, we'll have enough users so that we can provide useful location information for the state of Connecticut.
In a state the size of Connecticut, can you give us a sense of how many users that would be to be useful?
So for the state of Connecticut, I think what we can find is that there are going to be many different geographical areas. For example, the New Haven or Hartford, there are going to be different regions. And so what is critical is to get enough people within each one of the regions. And we may not get enough people for all the regions all at once, but starting in more concentrated areas, we hope that we can get sufficient data. For a place like Hartford or Connecticut, if we can get 50,000 users, or maybe even lower, 10,000 users, that should already be enough for us to get quite a bit of information.
And Governor, just one quick follow-up on the workers' comp question. You said you're going to be looking at it, but Labor has indicated they have asked the administration a while ago to look at it. So are you saying that this has not been examined at all yet?
No, I think our team has examined it. I haven't gotten any recommendations from them as yet, Paz.
Okay, thank you.
Move on to NBC Connecticut.
Hi, what is the cost of this collaboration with howwefeel.org? Is there any cost to the state?
No cost to the state that I know of.
Nope, zero.
Okay, that's great. And my second question is actually a follow-up to something I asked last Friday regarding the state's decision to continue to collect a bottle deposit. Paul, you had said that the state would continue collecting that deposit because you never ordered redemption centers to close. You just gave them guidelines for staying open. However, I did a survey of both the redemption centers listed on the state's website, big box stores, major grocery chains across the state, and none of them seemed to be open. And when I asked why, they said it's because the state ordered them closed. So while they may be misinformed, they do all seem to be closed. So would you consider revisiting that decision to keep collecting the bottle deposit?
Be happy to get back to you if we have further discussions with the Department of Energy and Environmental Protection.
Thank you.
Good catch.
Move on to Fox 61.
Zinnia Maldonado, Fox 61. Governor, will there be any type of enforcement for wearing face masks? We know you can't easily enforce something like this, but for example, if a resident needs to take mass transit to get to work but doesn't have a face mask on, the bus driver wants to be safe, but they can't deny a person entry on the bus. What should be done in a situation like this?
I think a lot of enforcement can be done at the local level. You know, my philosophy on that is at this point in time, we'll go up and we'll tell you this is what the rules are, and I want you to follow the rules. There won't be a fine or a penalty at this point, and we'll see what transpires from there. But so far, in all of our different, executive orders, safe stores, safe manufacturing, the enforcement hasn't been a big issue because everybody's tended to follow the lead in a serious way, for which I'm most appreciative.
And then you mentioned new thermometers that will check temperatures, especially important for essential workers at manufacturing jobs. But what about those who don't show symptoms but are positive and are still coming into work? Is there any way you guys are working on how we might be able to pinpoint those residents?
Well, obviously, testing is the best way to do that. The antibody testing would say if you had built up some sort of an immunity. Otherwise, the PCR testing But that's a big deal to ramp that up to such a degree. You'd have to test that on every week or so because people can get infected. So in the meantime, the fever test is a way that we can see at least a very early symptom, obviously followed by the How We Feel app, which gives us a broad base of what we're trying to do, and masks. It's going to be really important that all those folks, if they can't maintain that 6-foot distance, have to wear a mask in a manufacturing facility.
Move along next to WTIC 1080 News.
Good afternoon, Governor.
Good
Something
afternoon.
different today. Oil prices plummeted to negative $38 per barrel. Are you hearing anything about the pressure being put on gas stations and small business in Connecticut due to something that's unprecedented and unheard of?
Well, it's a shocking number considering where we were just a year ago, not to mention 10 years ago. I want to make sure that that drop in oil prices is reflected at the gas pump, first of all. I think that's, incredibly important. I know what it means in terms of our transportation fund, because we rely upon the gas tax to rebuild our roads and bridges, and that's taken a real hit. So I think about the plunge in gas prices in a different way than many people do. It's also going to have amazing international security issues. Russia is going to lose their base of funding pretty fast. And what's that going to mean in terms of transforming that country? We'll see.
And if I can, earlier on the teleconference with the White House, a few of the governors asked Vice President Pence to ask the president to, ask protesters not to come out like they are going to shortly in Hartford. Did you join in that call at all?
I definitely joined in the call. I don't remember that particular question, but I'd echo what my fellow governors on both sides of the aisle said. I mean, the president was pretty clear a couple of days ago. I'm going to leave it up to the governors. I'm going to give you the best guidance I can, but you're the place where the rubber meets the road. So we don't need him going out and, inciting people to, create some disturbances. We're going to work through this in a very collaborative way, and I look forward to making sure the protesters keep a good, safe social distance and make sure they don't get infected.
Thank you.
We'll move on to the Waterbury Republican American.
Thanks. Sorry about that. I wanted to get a little better handle on the level of testing and how soon that testing would be available for Connecticut to be able to get back to the new normal, I guess. How many, I thought I saw a statistic about 85 tests per million right now. What would it have to be? What are the testing needs here?
I'll start off, and then maybe Josh would pick up on it. We've ramped up our testing big time. As you remember, originally you had to send everything down to Atlanta, then they let us do it within our own public lab. Now we have testing going on at 20 different hospitals, and not to mention Jackson Labs and a number of other private. Jackson has told us they could get up to 10,000 tests a day. Abbott Lab is going to get up to 1,000 tests a day. So we're going to be able to ramp up in a significant way, and that's just the PCR testing, the testing that determines whether or not you've been infected or not. Josh?
Yeah, that's right. And one of the main work streams that the Reopen CT Advisory Board is studying is this testing ramp-up strategy, both what we want to aim for in terms of testing volumes and then also how we operationalize that, looking at all the different testing technologies, the different sites and delivery methodologies. One of the really great things about having Dr. Coe on this task force is that Yale has a tremendous research organization where they're looking at all these emerging technologies and helping us get good headlights into what could become part of our testing portfolio so we can get out in front of that. So we'll have more to share on that in the coming weeks.
Yeah, but when will this fever testing start? When will you because obviously with this protest today, there are people who want to get back to work, and that's a legitimate concern. So when will you guys be in a position to be able to say, yes, we'll be able to do fever testing, we'll be able to do antibody testing, we'll be and not just first responders or people who have a note from the doctor?
Well, remember, the Abbott lab test right now, all you do is fill out CVS.com, put in your symptoms, and you line up for a test. I got to say, they're very popular and they're filled up. You're going to see a dramatic increase in testing such that we'll be able to make a determination before May 20th about what is the best staging for getting the state opened again. That's a key date for me.
Okay, thank you.
We'll move on next to the Associated Press.
Good afternoon, Governor. It's Sue Haig. Regarding the contact tracing, how do you see that fitting in Connecticut's plan to reopen? And how much of it is happening now? And do you plan on having it more of a technology-based endeavor, or you sort of mentioned earlier that you had a little concern about people going out to residents' homes. So how do you foresee it happening?
Well, Sue, we've got probably 50 experts on the reopened Connecticut, including those that specialize in testing, specialize in a lot of the databases that we're looking at right now. I know Charlie Baker in Massachusetts. I know the CDC down in Washington, D.C. They're thinking about this in terms of a manual operation. Charlie's got probably 1,000 monitors already hired who are there finding out who's been infected and seeing who else they worked with. As I said before, that seems fairly labor intensive. I'm not sure you could scale it up fast enough. So I'm also curious about the technology platforms out there, like the Google Apple one, with due deference to absolute privacy, because that's sort of a hallmark of our country.
And you mentioned that the federal government is getting out of the way of states being entrepreneurial when it comes to finding alternatives for the swabs and the reagents. Can you talk a little bit about, more specifically, what Connecticut, the state, plans to do to try to, make those supplies available?
Yeah, working with our labs, see what we can do now that we have the cotton ingredient, allowed to use that for the swabs. Before it was a special material, half of it came from Italy. Italy was in the middle of a pandemic. There was an enormous shortage. So that opens up a lot of possibilities for us. We'll be working with the entrepreneurs at some of our life sciences companies to see what they can develop there. What are the best media to transport the swabs? I mentioned the saline solution. That would be transformative. Anything that lets us get control of this process ourselves, so I don't have to wait for China, I don't have to wait for Italy, I don't have to wait for the stockpile in Washington, is a big plus. So I appreciate the federal government getting out of the way and giving us some of these options. Also, there's a couple of amazing Connecticut companies that are working on the saliva test. And you'd be able to self-test on almost a daily basis. And if we find out that we're able to do this in an FDA-approved way, accelerate that process. You want to get a big testing, as Paul was alluding to, imagine if you could do a self-test, a saliva test on a regular basis at your own home and get that transported and analyzed in real time.
Thank you.
We'll move along to Connecticut Public Media.
Thank you. I have two data-related questions, and the first is for probably Josh on death numbers. And it's, does the state have any specific number on how many healthcare workers in Connecticut have died from COVID-19 related complications? And if so, is there any breakout between workers at hospitals and workers at nursing homes?
We don't have that data, the data split out that way now.
Okay. And the next question is a general question for the governor on data collection. Governor, if howwefield.org is aggregated to zip codes, are you talking about possibly taking targeted public health actions in certain zip code future? And if so, could you maybe just talk a bit about how that might?
Yeah, I might ask Dr. Jung to help me with that answer, but zip codes is an anonymized way that we can able to see where there might be potential flare-ups. Look, this is not going to go away on May 20th. It is not going to go away on July 1. And we've got to be able to track this in sort of a real-time basis. So, Doctor, maybe explain a little more how the zip code gives us actionable intelligence.
Sure. So through the data that we collect, it may be possible that we can identify certain zip codes to have more people who are infected. And that information may allow us to distribute more personal protective equipment, for example, making more masks available. providing more information and more advisory for social distancing. And those are the things that may be possible if we have more nuanced information about if one specific area is more severely affected.
But would we be seeing closures coming back in certain areas that had already reopened? I'm just trying to get some clarity on that.
That's to be determined. You know, and I've said before, I'm terrified of the fact that, like some of those other countries I referenced, you could have a second surge, maybe not as severe, but a second surge. And some of those other countries are beginning to close down some of their, socializing places, any bars and restaurants and the such. So I want to be very careful that we don't have to go back. I just think that would be a body blow to our economy. I want to make sure we stay open, and we go forward from there.
Thanks.
We'll move on to Hearst, Connecticut Media.
Hi, can you hear me?
Yes, sir.
Hi. I'm kind of interested for you to go into a little bit more about the peak, Governor. It's going down in Fairfield County then, and when do you anticipate it having peaked in New Haven?
Again, as you could see, based upon just a very short sample, 3-day sample, it is leveling off anyway in New Haven, and that's amazing good news. That's not New Haven City, that's New Haven County. And that shows in a place that we have a fairly dense population, you got Waterbury, New Haven, they are beginning to make a difference. They're following the social distancing. Obviously, it's ramping up in Hartford. I worry a little bit about Eastern Connecticut just because of Boston and the fact that that's on fire right now.
And Governor, I don't know when you found out you were talking about the 35% African Americans. What can you do in the shorter term at this point?
Well, the first thing we wanted to do is make sure we get the testing in an urban environment like New Haven, where we have the broadest options for people to get tested, and B, provide transport for people who can't get transport there, so we can find people who are infected earlier and be able to provide treatment for them on an earlier basis. I think that's number one. And as Paul mentioned a few days ago, I think, this is just one of the long-term reminders of what we learn out of this damn pandemic, which is the health disparities in our country. And we got to do a better job of making sure that asthma and diabetes and a lot of those comorbidities that can impact you not just with COVID, but otherwise we treat on a more comprehensive way. I'm really proud of the fact that we were able to expand coverage of healthcare in a dramatic way over the last couple of months to make sure everybody knows they're going to be able to get the testing, get the treatment they need at no cost, and we have many more people insured than we did before. So those are important criteria going forward.
And I'll just add this. I'll add this, Ken. Remember, this is our first site, one of our first sites in Connecticut, in which you don't have to go to a primary care physician to get appointment for a test. And so that's going to give us the ability to expand upon the opportunity that the CVS Minute Clinic site in New Haven has created for the state. So we're going to be looking for additional expansion opportunities with various other partners to expand testing in our urban communities.
Thank you.
Move on to Boceto Media.
Hi, good afternoon.
Good afternoon.
Good afternoon.
Can you hear me?
Yes.
Yes, we can.
Good afternoon. Today, Governor Cuomo said that he will use the situation to improve many services in New York. Governor Lamont, how will you use the situation to reimagine, improve, and build back better in Connecticut? And my second question is, as protests are racing throughout different states in the United States, including Connecticut, can you talk about your plans for the multi-state council members that will be working with the regional council to reopen the economy?
Yeah, the second question first. You know, Indra and Alfred Coe will be representing Connecticut along with Paul Mounds. They're already having informal conversations, you know, really right now about testing, about antibodies, about PCR, what we can learn from each other going forward. And that will result, I think, in some of our first formal meetings in terms of what we're learning in terms of best practices and thinking about in terms of schedule. Your other question is really important. And Governor Cuomo is right. I mean, out of this crisis, what have we learned? What can we reimagine? How can we be better? You know, we just mentioned the health disparities and what that means in terms of communities, what that means in terms of pandemic, not just for the community, say the African-American community, but for our broader community. And we're going to learn from that and expand on that. It reminds us of the incredible importance of you know, universal health care so that everybody has a level of coverage so that they don't feel like they have to stay home if they're very sick, because we know what that can mean. I can tell you, I'm thinking a lot right now about the state of Connecticut and how we're positioned on the backside of this pandemic. I can tell you that there were an awful lot of businesses and homeowners who are thinking about Connecticut in a whole new light. You know, if in the last 15 years, oh man, I want to be in the big city, that's where the action is. If your office isn't in the big city, you can't get the millennials, and that disadvantaged Connecticut over the last 15 or so years. I think now you're seeing some real advantages with the idea that social distancing may come up again, the idea that you can work from home and telecommute. You don't have to be in, say, the Big Apple or Boston 5 days a week. I think people are going to take a whole new look at a state like Connecticut, and we're going to figure out how we position ourselves going forward. Those are two very different answers to your question.
Thank you, Governor.
We'll move on to CT News Junkie.
Hi, Governor. I wanted to know, you cite hospitalizations as something that you're watching when it comes to reopening the state. So how many days in a row will they have to drop if Connecticut's going to reopen by May 20th?
I think that the Pence Council in Washington said, you know, 28 days, 14 days for Tier 1, which is sort of almost where we're going to be pretty soon. And then 14 days for Tier 2, and Tier 2 gives you permission to think about schools, opening up retail with all the necessary practical precautions. So, Christine, that's why I think May 20th is a date where we really can make some much more informed decisions. And as we tried to talk about in this press conference today, hospitalizations is now just one metric. We're going to have a much better sense of infections, immunizations, fevers, precursors to what may be happening out there, so we'll be much better informed over the next few weeks.
And Governor, the Connecticut Legal Rights Project is asking you to release people, if possible, from state-operated psychiatric facilities. Is that something that you are considering?
It's something I got to look into, Christine. It's release to what? You got to make sure that there's a safe place where somebody in that state can be protected and has the necessary support and counseling they may need. That said, absolutely, just like we're doing in other compressed environments where the pandemic can spread. I'll just leave you one thought. Susan Beitschwitz and I were at Rentschler Field this morning, bright and early, because Food Share was distributing food on a drive-up basis. And there were hundreds of cars that got there 2 hours earlier than it opened at 8:30 in the morning. And these were good folks who had a good job, and things were doing pretty good for them up until about a month ago. And there were a lot of people that were scared there. And but thanks to Food Share, thanks to 4CT, which raised a fair amount of money to help buy food, thanks to some amazing volunteers. Cars were in that line for an hour and a half. They didn't want to be there. They weren't taking advantage of a situation. But it was a state, and thanks to volunteers and thanks to Food Share, we were able to take care of people. It is that type of spirit that's going to help us all get through this, and we're making progress every day. I do believe that. Thanks, everybody.